Several days ago, there was a very important headline. It concerned a mother in Brooklyn who had COVID-19, and like many other sufferers, she had trouble breathing. The headline reads, New York mom with coronavirus saved by medical students' quick thinking. Now, the otherwise healthy 48-year-old Brooklyn woman was desperately ill with coronavirus. She, like many others, was having a lot of trouble breathing. She was so short of breath, she couldn't speak. The family was extremely worried because she couldn't stand up without passing out. This was due to her shortness of breath from the virus. The hospital they rushed her to, with no coronavirus testing available yet at the time, sent her home with a suspected COVID-19 infection and a diagnosis of pneumonia. Her other symptoms were fever, body ache, dry cough, and a loss of the ability to taste or smell. Pretty typical. Her 23-year-old son, James Bruzzese, he's a medical student at CUNY. He was worried about her severe respiratory tract symptoms. Her doctors used prescription drugs to help her. These reduced some of the symptoms, but nothing was improving her breathing. James Bruzzese contacted an associate who he interned for, Dr. David Horowitz, at the Hudson Valley Healing Arts Center, who treats Lyme disease patients. Dr. Horowitz suggested trying a supplement called glutathione. Glutathione is a very important antioxidant in the human body. We make it, and one of the things it protects is our upper respiratory tract and our lungs. He uses it to reduce inflammation in his Lyme disease patients. Dr. Horowitz said when you get a viral infection with a huge amount of inflammation, you don't have enough glutathione to protect your sensitive lung tissue. In other words, you can't make enough to meet the body's needs during an infection. The level drops very quickly, just like vitamin C and some other nutrients would drop during an infection. Now, according to the family, after one 2,000 milligram dose of glutathione, they witnessed a miracle. According to the patient, Josephine Bruzzese, within an hour, my breathing got better. It was amazing. I sat up, I got up. She made her bed and states, I went and I took a shower. She took the pills for 5 days and she had no relapse, her son said. GSH is the accepted abbreviation for glutathione. That's what we're talking about on this episode. Dr. Horowitz and James Bruzzese just published their experiences with GSH in the journal Respiratory Medicine Case Reports. They also discuss a second coronavirus patient with breathing issues in their journal article. This fellow, of course, had a tremendous difficulty breathing. Unlike Mrs. Bruzzese, who swallowed a GSH supplement, they gave this man an intravenous dosage of glutathione. Intravenous means they injected it directly into his bloodstream. The patient says he soon felt much better and states within a half an hour it helped with the breathing symptoms in particular. This is pretty breakthrough, by the way. Dr. Purvi Parikh, an infectious disease and immunology specialist at NYU Langone Hospital, said glutathione may help in calming the immune system's overreaction to the coronavirus, known as cytokine storm. So let me give you a brief description of what that is. When your immune system first starts attacking a virus, it's the innate immune system, which is a little bit milder. And that, for many people, will contain the virus and help prevent it from getting into their lungs and hopefully their brain and their heart, etc. For some people where the immune system wasn't up to par, the virus will proceed and get into other tissues and organs. And then eventually a second part of the immune system reacts, a much more powerful part of the immune system called the adaptive immune system. This is where the antibodies are and the natural killer cells and the T cells. And it literally triggers such a backlash against the virus that it can damage the tissues where it takes place. So they call it a cytokine storm. So this is happening to people's hearts and their lungs with the COVID-19 infection. The immune system eventually has such a powerful response, it's destroying their body. It's the same thing you would see in an autoimmune disease like lupus or rheumatoid arthritis. Now, me personally, professionally, I've been recommending glutathione and its precursors, because you can also make it out of other supplements, to our clients for decades, and it can offer amazing results for many conditions. It's very safe and actually boosts wellness. I mean, you feel much better on it. And it's not expensive. It's important to note that glutathione activity declines with age and during many disease states. So welcome to our Glutathione Help Those Coronavirus Patients Breathe Again episode. Hi, my name is Jerry Hickey. I'm a pharmacist who also has studied nutrition, and I'm over here at Invite Health. I'm also the scientific director, and I'd like to talk to you today about how glutathione can help you and your lungs during the times of crisis such as with an infection. Please be sure to subscribe to the Invite Health podcast today, and please leave us a review. You can also follow us on Facebook, Twitter, and Instagram at Invite Health. All of the information on today's episode will be linked in the episode description, and you can visit invitehealth.com/podcast for more information. So let's get going. Glutathione is a very tiny protein that's made by our body. It's made of only 3 amino acids. It functions as a powerful antioxidant protector throughout the body. It's highly concentrated in our brain. It protects our brain, our eyes, our lungs, our heart, many other tissues. It's very active in our major organs of detoxification. We'll have to do a second podcast on glutathione because it just has so many health benefits. So it's very active. Our major organs of detoxification would be our kidneys, our liver, but also our lungs. We exhale a lot of toxins. Our immune system's white blood cells and our red blood cells also have to be rich in glutathione. This helps protect our red blood cells while they carry and distribute oxygen, which is attached to the iron-rich hemoglobin within the red blood cell. Glutathione also protects our immune cells from their own chemical arsenal, so they survive and can efficiently go on to kill viruses and other microbes. For our metabolism, when we use oxygen and sugar to create energy, this releases a vast pool of free radicals. This occurs in every cell in our body. Free radicals are highly unstable. If left unchecked, they can kill our cells, and levels of this free radical activity weakens and ages us. These same free radicals are part and parcel of many dangerous diseases because they also inflame us, and this damages our organs and tissues. And these diseases, the free radicals generated, cause many of the comorbidities. Comorbidities are things that commonly occur along with the initial disease. Let's take, for instance, diabetes. Diabetes is a metabolic disease. Your blood sugar's high, and so are your blood fats, like your triglycerides and your cholesterol. Plus, you can't make energy very efficiently. If you can't use sugar, you can't make energy. So diabetes is not just a disease of sugar, it's a disease of metabolism. But there's many comorbidities. The inflammation generated during diabetes damages the brain and increases the risk of Alzheimer's disease and vascular dementia and stroke. It damages the heart and arteries and increases the risk of heart attack and sudden cardiac death and ischemic events of the heart. It damages the kidneys. It damages your nerves. It leads to fatty liver. It causes a lot of other things. These are comorbidities. So a lot of the comorbidities in these major diseases are triggered by the inflammation that occurs. That's due to the free radicals. Getting additional glutathione helps snuff out the free radicals, which in turn reduces the inflammation, which in turn protects your organs and systems during disease. Besides diabetes, some of the diseases whose pathologies are related to lower glutathione levels include neurodegenerative diseases, like disorders such as Alzheimer's disease, Parkinson's disease, Huntington's disease, amyotrophic lateral sclerosis, different forms of ataxia. Lung diseases, pulmonary diseases such as emphysema, chronic obstructive pulmonary disease, or asthma, or acute respiratory distress syndrome that you see with viral infections. Immune diseases, like HIV, and autoimmune diseases, where your own immune system is attacking your tissues, like lupus and rheumatoid arthritis. Heart diseases, cardiovascular diseases, like hypertension. Myocardial infarction, that's another name for heart attack. The oxidation of cholesterol. Cholesterol itself doesn't hurt you. It's when it goes bad, when it's oxidized by free radicals, that's when it hurts you. As well as elevated HSCRP. That's a proxy for inflammation in your heart. We speak about that in a separate episode. Chronic age-related diseases like cataracts and macular degeneration and hearing impairment and glaucoma have a great deal of inflammation as part of their pathology, and this is also related to low levels of antioxidants, including glutathione. Liver diseases. And the aging process itself, a lot of things that go wrong with aging have to do with a drop in our internal antioxidant enzyme systems, not just glutathione, but also catalase and superoxide dismutase. Before we go any further, let's just go to a quick break. Jerry Hickey for Invite Health will be right back.
This podcast is brought to you by InviteHealth.com. For over 20 years, Invite Health has provided premium quality supplements and expert advice you can trust. Now, first-time customers can enjoy an exclusive offer. Visit invitehealth.com/podcast or click the link in this episode description. That's invitehealth.com/podcast for your exclusive offer on Invite Health products. Invite Health offers the resources you need to make important decisions about your health. Chat live with degreed healthcare professionals, get product information, and find retail locations near you at invitehealth.com. You can also learn about our new genetic testing program and our exclusive Invite Fitness Wellness program. Follow Invite Health on Facebook, Twitter, and Instagram, and be sure to subscribe to our podcast today. Now back to our episode.
Welcome back. In our body, glutathione is the most common antidote to tissue-destroying free radicals that otherwise would inflame us and contribute to many destructive injuries that would occur with our most common diseases. It's very important to note that the availability of glutathione also declines during the aging process. Glutathione activity does decrease with age, and this affects our brain health, our lung health, resistance to infection, tolerance to airborne pollutants. That's true. Pollution becomes more dangerous with age, and also susceptibility to disease. Personally and professionally, I've been a fan of glutathione for about 40 years. Back in the 1980s, I started recommending glutathione supplements to clients with lung conditions. Some had asthma, some had chronic obstructive pulmonary diseases like emphysema. Many had allergies. I also recommended a glutathione precursor called NAC, N-acetylcysteine. NAC is the rate-limiting factor for creating glutathione. You take NAC, it is easily converted to glutathione. But NAC also has the added advantage of breaking up mucus and being fantastic for helping reduce the symptoms of allergies. I mean, it's just unbelievable. The first major book on glutathione was authored by my good buddy, Dr. Alan Pressman, in April 1998. The book's title was Glutathione, the Ultimate Antioxidant. I was interviewed repeatedly for this book, and this focused attention on using glutathione literally for many thousands of medical practitioners and nutritional practitioners. That's because besides the book, both Alan and I frequently lectured, and both of us had side jobs teaching doctors nutrition on the weekends. We also had a TV show together that was throughout the country. Very interesting. NAC is inexpensive. It's safe. It works. For many, it really improves their conditions. It really makes you feel great. I mean, it just relaxes your brain and helps improve breathing, and it's great for your liver, and it helps your muscle function. The only caveat with taking NAC is take it with food. I mean, even a tiny snack will do. Otherwise, it may mildly upset somebody's stomach. If you take it with food, even a snack, it prevents this. For decades, our scientific department has been promoting the science of glutathione. Unfortunately, it took this pandemic to really bring it into focus nationally. Now, glutathione and its precursors help many lung or respiratory tract conditions, not just protecting the lungs of people with viruses, but right now, of course, we're in a pandemic. But this includes asthma, helping people with asthma, bronchitis and bronchiectasis and emphysema. Also for the upper respiratory tract, as I mentioned before, it's fantastic. It breaks up phlegm. It reduces the symptoms of allergies. I usually recommend taking NAC, it stands for N-acetylcysteine, 600 milligrams 3 times a day with food, which could be a meal or a snack. And once again, the reason for using NAC, it's very affordable, it's really well absorbed, and it's quickly converted into glutathione. The other nutrient that easily converts into glutathione is called alpha-lipoic acid, often abbreviated into ALA. We combine alpha-lipoic acid with Alcar for improved metabolism, as well as increased antioxidant defenses for older people or people with certain health conditions such as nerve damage or diabetes. Creating glutathione helps many conditions ranging from Parkinson's disease, which is a brain disease, to liver conditions. But on this episode, of course, we're focused on immunity, and more specifically on immunity with viruses. Interestingly, we include NAC and other nutrients needed to create glutathione and recycle glutathione because it's so important in the eyes and for good vision. It's important in the crystalline lens to lower the risk of cataracts. It's important in the back of the eye to help prevent age-related macular degeneration, a leading cause of blindness in aging people. We've done a podcast on this. It's extremely important for protecting the crystalline lens and the retina of our eyes. No two ways about it. But we've been recommending these vision formulas. One's called Macula HX tablets, and the other's called Macula Advanced HX, and these vegetable capsules. Directly to our clients on our website and on our radio programs since the onset of the COVID-19 pandemic. This is around February when it became obvious, because it offers so much protection for your lungs, but it also has so many things that improve your immune system activity. I've been telling people, take one of our macula formulas, vitamin D. In the macula formula, you're getting some vitamin A, you're getting zinc, you're getting vitamin C, you're getting the glutathione precursors such as NAC. So the eye formulas support glutathione activity, and although they are designed for the eyes and they're also supportive for your memory, they are also near perfect for supporting your immune system. At this point, I think what we're going to do is break off, because I want to go into studies and the science of glutathione, and that's going to take an additional episode. So thank you for tuning into the Invite Health Podcast. You can find all of our episodes for free wherever you listen to podcasts or by visiting invitehealth.com/podcast. Please make sure you subscribe and please leave us a review. You can also follow us on Facebook, Twitter, and Instagram at Invite Health. We'll see you the next time on the next episode where I talk about glutathione and the science behind it for your lungs and respiratory tract infections. And thanks for listening.